Hello, my name is Richard Smith, and in this short video we're going to talk a little bit about comfort in the chair and some troubleshooting tips on what to do if your user is not finding the chair comfortable. We think comfort's really important. Now, you might not issue a chair for comfort as a reason by itself, but if the chair is not comfortable and the user doesn't tolerate sitting in it, none of your other aims can be met. So comfort is important, and at any point we're happy to do a revisit to help you to try and find a solution. Now, in terms of comfort, there's really four things that will affect the comfort in the chair. The first is a transfer. The second is the size. The third is the pressure cushion that you've got, and fourth is the postural options. So let's just look at this one by one. Transfers. It's really important that the user is well back in the chair. If they're not, the armrest will appear too high. The postural work or the postural options that you've fitted to the chair will also appear too high, and when they tilt the chair back and raise the legs, the feet will hang off the end. So transfers are really important, and this area is often quite difficult because for users who are transferring into the chair with assistance, getting the pelvis to the back is often quite difficult. But if it's not, it's likely that the chair won't be comfortable. So first of all, do some work around the transfers and see that the user's pelvis is as far back as possible. Of course, transfer relates a little bit to size, and that's the next thing we're going to talk about. So size, is the chair in overall terms the right proportion for the user? So does the user look lost in the chair? Have we, broadly speaking, got the correct size? And then a little bit more specifically, have we got the right seat depth? So if it's too great, the user might sacredly sit and therefore be uncomfortable. But if it's too short, you'll find that you've got the thighs are not supported well enough, and the legs will then tend to hang off the end of the leg rest. So getting the right depth is important, and if in doubt, I would suggest go generous on the seat depth. We can always reduce it, and here's how. Remove the cushion, the pillows from the backrest, and then fit a depth adjustment kit and just replace the pillows. So as you can see, this simply reduces the depth of the chair by 2 inches. This can help the user to be more comfortable, especially if the depth is too great in the first place. Also check the seat height. If it's too low, the user may be finding it difficult to transfer off. If it's too high, the feet might be hanging, and again could cause comfort issues. The other thing to look at is the cushion in the chair. We do have different cushion options that can be used, and the cushions are quite easy to remove, like this, and we have different types of foam that can be tried. As standard, the Configura Rise and Recline comes fitted with a visco cushion, which has a high risk pressure reducing foam. We also have what we call a castellated cushion, which is similar to the visco in terms of performance, but doesn't have visco foam. Some users, especially if they've got reduced core body heat, don't get on with the visco cushion. So you've always got the castellated cushion to try. We also have a dynamic cushion, and if none of those options work, we have a drop-in self-supply overlay, which allows you to insert your own cushion. There's a separate video on how to use that, which you might want to watch. The next thing is posture. There are different postural support options that you can try with the chair, and these may well have an impact on comfort. The most popular backrest we find is the waterfall backrest, and you can be creative in terms of removing stuffing and changing the way the waterfall backrest works. So to remove stuffing, undo the zip, make a cut in the bag with your fingers, and just take the stuffing out. By doing this, you can accommodate different posture requirements, for example a kyphosis. Let me just show you another tip on how to accommodate a kyphosis. I'm just going to take the depth adjustment kit out. So for users that have got a kyphosis, sometimes we actually rotate the cushions through 90 degrees, like this. And in this way, It accommodates the kyphosis quite nicely and helps the user to be in a better position to interact, especially when you use the tilt in space. So you can be a little bit creative about what you do with the pillows. If the user doesn't tolerate the waterfall backrest, you can try the lateral support backrest. This helps the user to retain a good midline posture and is really appropriate for users whose posture is flexible. Typically for users with perhaps MS or MND, those types of conditions where they need to be encouraged to retain a good midline. If this isn't enough, we can try the adjustable lateral support system, which provides a more aggressive level of lateral support. Here you can move these laterals any way you like to help to manage and correct posture. So hopefully this has been helpful. If you've got a user that's not finding the chair comfortable, think about the transfers, the size of the chair, what cushion they've got and the posture. And hopefully in this way we'll be able to make the user comfortable. And remember, we're happy to visit, so give us a call if you've got any questions, and thank you very much for watching this video.